Hello, and welcome to a presentation on Autism Level 1 by James Walkowiak and Kindra Mosher. In this presentation, we will discuss the definitions, prevalence, warning signs, and diagnostic process of Autism Level 1. We will also discuss classroom tips, support inside and out of the classroom, and long-term goals of the autistic community.
Autism Level 1 consists of persistent deficits in social communication and social interaction across multiple contexts with the individual or through the individual's history. Deficits in social-emotional reciprocity range from abnormal social approach and failure of normal back-and-forth conversation to reduced sharing of interests, emotion, or effects for individuals with an autism spectrum disorder.
Estimated prevalence of autism spectrum disorder among children around the age of 8 came to a total population of 325,483 individuals for the 11 states listed on the chart, based off of a 2014 study.
On average, 1 in 42 males and 1 in 165 females are diagnosed with some level of an autism spectrum disorder. Boys are 4 times more likely than females to be diagnosed. The reason for this is not yet known. Several factors have cited male genetics, shot reactions, and other issues of the prevalence in boys, but none of these factors are known causes.
Autism affects all socioeconomic groups, although minority groups tend to be diagnosed later and less often. It is believed that this is primarily due to a lack of proper healthcare in infancy. Early intervention provides the best opportunity to support healthy development and deliver benefits for life.
Early warning signs include lack of social smiling by 6 months, lack of appropriate vocal contact by 24 months, poor eye contact, lack of general interest in the world around them, unusual attachments to an item or routine, not responding to sounds, and loss of skills at any time. Signs and symptoms can also include lack of social contact desires.
Autism Level 1 can be diagnosed as early as age 2. However, most diagnoses take until age 4. Parents can advocate from birth for their infant by sharing concerns with their child's physician or advocacy groups for autism spectrum disorders. Early intervention is key in Level 1 autism. Early intervention provides the best opportunity to support healthy development and deliver benefits for life. This includes physical and occupational therapy, speech therapy, and in-home and support groups for the family, along with play therapy groups for the individual with Level 1 autism, and regular physician and specialist visits.
Individuals with autism level 1 will display noticeable impairments in social communication. Proper therapy and support are needed for the individual with level 1 autism. Level 1 autism is the least severe form of autism on the spectrum scale. Social structure, occupational therapy, speech therapy, and support provides many autism individuals with the tools they need to function at this level.
Organization is essential and critical to those with autism level 1. Lack of organization and consistency can make it hard for the individual with autism to perform daily and classroom tasks. Organization in life for these individuals sets the guidelines for expectations and gives the individual with autism the opportunity to work independently.
Stress plays a large role in the individual with autism's life. Keeping stress to a minimum is in their best interest. Consistency and organization will help with this. Family support is another way to minimize stress for the individual with autism level 1.
Don't take it personally. Individuals with autism and their behavior is not personal and not directed to any one person. This is where routine, organization, and patience play a key role. Stability is the best scenario, and remember to stay calm. Your response to any situation can change the whole day for everyone.
Direct, concise instructions in the classroom for the student is imperative. Clear guidelines and expectations can help the student process the concept of what needs to be done. Confusing or lengthy instructions will only frustrate the student with autism.
Avoid figurative language. Do not use metaphors, sarcasm, or confusing language with a student who has level 1 autism. This can create panic and upset the student who does not understand what you mean or what you are trying to convey. Keep it simple, clear.
Treat all students with respect. Treating all students with respect and kindness, regardless of ability, is mandatory. Treating any child with a disability differently is prohibited. Students with Autism Level 1 are capable of learning core curriculum, and like children with all types of disabilities, must be treated as such.
Looking at the future, many children with autism strive to find jobs. However, many diagnosed with autism never have held a job, and those who do work only part-time, equaling less than the poverty level. Research has shown that jobs that provide independence reduce autism symptoms. There are many resources and support for families with autism children. In the Buffalo area is the Buffalo Autism Project, and in Fort Drum is the Operation Autism that serves military families with autistic children. Both resources are a beacon of support for many families and give great information. While we focus on the young portion of an autistic student's life, we should also look toward the rest of that person's life. The support in place for adults is very limited, and many times they age out without proper direction of what to do. However, movements across the nation have begun to show support for all age ranges, including the Ketterberg Center. And finally, for families and loved ones, there are support options for those who are affected as well. Autism affects all members of the family, and many support groups designed for those diagnosed with autism also support families and give attention to the caregivers, along with the loved ones. Thank you for watching this presentation. As we end this presentation, we ask that you think about this. As a teacher, what is one tip or practice that you feel would have the most impact on a student with Autism Level 1, and why?